back again to our video blog. September is Suicide Prevention Month, and so we're touching on some of the questions around suicide. So another question that I get is, how do I help someone that is currently experiencing suicidal thought? Well, the very first thing I think is to take a step back and say, there is so much shame and stigma around suicide that many people feel absolutely mortified about the idea of bringing it up. So the very best thing that you can do is when someone brings it up is to not trigger more shame in them. I think to be able to create a place where you can say, hey, lots of us experience time of feeling down, depressed, or blue, and you are not crazy or you are not a terrible person for experiencing these thoughts. I think another thing is to be able to connect with the fact that a thought doesn't necessarily mean that that person is going to go out there and do it. So it doesn't mean minimizing that, but I think to be able to say, okay, because this is a thought, there's a lot that we can do to process and talk about it that can change the thought. So as a loved one or a friend, I think the biggest thing is to highlight that there is hope. The vast majority of people that think about suicide don't actually want to die. It's that they don't have any other alternatives that they can think of to avoid and escape the pain and suffering that they're experiencing. And so just being able to emphasize the fact that while this pain is significant, while the situation feels hopeless, there is hope. There is another alternative or another way to see things. I think another piece is just to offer a lot of compassion and love, that they are cared for, that their life matters, that there would be no blessings or benefits that would come from them not being here any longer. I mentioned before that one of the most painful parts is that people feel like they were doing people a service by ending their life because they were so bad or the situation was so terrible that somehow they would be helping out their family. And so in a loving way, being able to affirm that's not the case, that one of the more painful things a family could experience is losing someone. And so those are really some key things. I do think it's important to see that, again, there's no shame in it. But don't feel like you have to take that on by yourself. And so I think being able to encourage someone that's having those thoughts to say, hey, you don't have to suffer like this. And so here's a recommendation for a therapist or a psychologist or psychiatrist that can take some of those first steps, I think can be a big thing too. So showing that love and that compassion and also saying, hey, you're not alone and let's take some of the appropriate steps to help would be a great way to do that. Again, shoot us over some more questions if you have some of that, and tune into our blog for more of these types of questions and information.